Hi, Karina.
Hello.
Yeah, so today, Michelle always asks us what we're going to talk about, and so I thought we'd get a little bit away from surgery and talk a little bit about skin, because we certainly are having patients come in quite a bit now from the summertime. They've been out there in the sun and the environment, and they're coming in with their concerns. So I know, Karina, you're at the front lines. You're our surgical liaison. You're also our medical assistant and talking to the patients when you room them, and you're assisting me in the procedures and so forth. And so they sometimes talk to you more than they talk to me. They kind of, maybe you're a little bit of a safer face, and I hope not. I hope that's not the case, but you're a safer face, and they may tell you what their concerns are. Then you, of course, always come and you discuss it with me when I go into the room with you.
Yeah.
So what seems to be the concerns of our patients lately when it comes to their skin?
Yeah, skincare is always important to our patients. They're always looking for sunblock or retinol or whatever it is, but seems to me that they are asking more about skin texture. And why is my skin a little bit rougher? Why is it a little bit drier? Those kinds of things.
Right.
Especially now that we're heading into the winter, and we're not in the sun with the oils and everything happening. So
okay, so skin texture. What does that mean? So I know that you were just showing me some photos on your phone, and we had a special event with one of our skin representatives from the medical Abaji line, which I love, and they brought in a skin analysis machine, and so you went through this yourself. I know you always like to you checked out yourself. And what did you find? Because you're only 27. How old are you?
Yeah, 28.
Okay, I love making you say that. You're 28 years young. Okay, and you have pretty much, you think 100% Latina
I think
skin,
so.
right?
I would hope so.
Okay, so you have a 2% Latina skin, and so you did this test yourself. Okay, and what did you find? What was sort of surprising?
It was very interesting to see your face magnified, just in that extent. But our Rochelle, our Abaji rep, was really good about going through kind of what a patient were to expect. That was more what we were trying to achieve. And of course it showed us our sun damage.
Sure.
So it shows the importance of the sunblock.
Right.
But one that I didn't really think about actually until she showed the little diagram to me, it was skin texture.
Okay.
And so, I mean, I don't really think too much about skin texture for myself. I don't think it affects me as much, but some people do. And it was kind of interesting. It was a yellow kind of T-zone area in the marking, so from my chin all the way up to my forehead, and the red she showed was your skin texture. So that's where your skin is a little bit more textured. You can have for myself a little bit more of those little kind of blackheads or that kind of stuff,
or roughness,
unevenness. And if I were to break out, that's kind of usually the area for myself that I do see that. So that was interesting to kind of see. We were playing around, so we didn't go into what is for you, but
So you showed that you had more issues with skin texture than you realized.
Correct, in those areas. I didn't really think about it.
So when patients come in and they're mentioning their texture, what kind of adjectives are they using besides maybe roughness? Is one word that I'll hear from a patient. My skin feels rough.
I think even thinking of the evenness of the skin, because I feel when you can kind of see texture, not to the extreme where like the orange peel where you can see how they have little holes, but it's just a little bit of that unevenness of the skin. It's not smooth. The cheeks may be smooth, but maybe, I don't know, another area looks
like a little rough and or uneven. And you mentioned, it's interesting, I wasn't sure where you were going with the orange peel, but you're talking about the roughness, the pebbliness of the orange skin. It's called peau d'orange in French, and indeed that is a concern for many patients. And another word that I might use for them, although they may not think of texture, is that they feel that their skin looks dull. That there's a dullness to their skin. And I look at you, and me being an aging baby boomer, I'm looking at you as an aging Gen Zer. I love it. You're aging. You're an aging Gen Zer. But the concern about our skin texture. So to start off with it, when they're asking us about that, Karina, is you start off with the basics. Always start off with the basics. Just don't jump to, oh, I need this laser or I need this treatment. So we want to start off with the foundation of good skin care, because what we're talking about when we talk about texture is we're talking about skin health. All right. So one of the most important things is actually cleansing our face. And I know we say that all the time, and why do we spend a minute or two on our show about that? It's because it's amazing how many people don't wash their face.
Right.
Wait, before you came to work with us, did you wash your face every morning and night?
I actually did.
Oh, good for you.
I actually did.
That's why I hired you. See, okay, I knew she was a smart gal. All right, so smart young lady. So you wash your face both day and night, and it's amazing how much grime, dirt, and so forth that we get, and pollutants, even if we're working indoors. Amazing how much we get from that, right? And one thing that we've learned from Hillary, our medical esthetician, is we talked about double washing, okay? And so not just washing your face once, but, and again, using a gentle medical cleanser that's not gonna take too many of the natural fats or oils in our skin away. We don't want to wash that away and dry out our skin. But in order to get the grime and the different, you know, the pollutants off of our skin, we recommend that they wash twice in the morning and twice at night. And so I've actually have adopted that. So do you do that as well?
Oh, yes, yeah. And especially, I think women tend to do it more than men because we wear, you know, product on our face, whether it's makeup or other things. And, yeah.
No, I totally understand. Hey, I'm a man of the new generation here, so, you know, I got my sunblock on, and it takes some time. If you have good sunblock, it takes some time to get that sunblock off, and what you want to do at nighttime for sure before you apply your products. Okay, so number one is washing your face. Do you use a washcloth, or do you just use the soap in your hands?
I have just soap in my hands, and then a little kind of silicone it's not really rough, it's just a little gentle kind of extra help.
Okay, so you use that to help to remove the debris from your face. Okay, and can you see when you go a second time and wash your face, do you see anything on that brush when you do that?
Yeah, sometimes I see it in my towel.
Okay.
I use little white towels to kind of help that, and I could see, and then I go a third time.
Okay, all right. So I'm kind of, even though I do all this, you know, all this skincare stuff, you know, I kind of just the dude, you know, I wash put the soap in my hands, wash my face once, and now I'm doing it a second time. Even when I go to the workout at the gym, you know, when I'm in the shower, I do it twice. So I think number one, that's important for our listeners, okay? And sometimes, especially if you're working outdoors, I know that my daughter, who's a professor at originally at Sonoma State, now at the Sonoma, the Santa Rosa Junior College, she also has a nonprofit, Equine Therapy, or Equisense is the name of her nonprofit organization. So she's outside using horses and using them as empath and therapy for a lot of different groups of people who can benefit from that type of therapy. But she's outside, and I just always laugh because she'll show up at the office once in a while, and what do I always say when I see my daughter coming in?
Sucking up the corporate profits.
She scares my daughter, sucking up the corporate profits. Exactly. She is, and so here she is coming in, and in fact, the whole team now knows that she's coming in to suck up the corporate profits. But my daughter, who I love, is she comes in and she gets a Hydrafacial, and we're lucky enough. I have such a wonderful relationship. She'll spend the night once in a while with us, and she happened to do that just after this last week, coming in and sucking up the corporate profits. That she had a Hydrafacial, and she said, "Oh, my skin feels amazing. It's been too long since I've had this done. I'm out there with the horses, you know, because there's a lot of dust and so forth. And so it made a huge difference for her. She notices that quite a bit. So wash your face morning and night. Hydrafacials, okay, and a Hydrafacial is actually, I'm going to let you. I wasn't going to have you do that. Tell me, what is a Hydrafacial? Yeah, you're doing the talking.
Okay.
Tell me, what is a Hydrafacial?
Hydrafacial is a medical facial, so it can be relaxing, but it's more. We want to cleanse the skin. It does give you a little bit of exfoliating, and then the nice part is that Hillary can tailor it to your skin and add some serums at the end, whether it is we want a retinol or a vitamin C to brighten up. You need hydration, so she can tailor it to you. So.
Okay, so absolutely. And so now, since I'm going to draw everybody in here, I'm going to draw in Michelle. In fact, she's like a little kid in school. She has her hand up like,
I wanted to talk so bad about it.
Michelle, tell us about a Hydrafacial. What is a Hydrafacial? Because I know you came in and handled it with us.
I had one. I felt so pampered. I felt like a queen when I left
Great, love to hear that.
It was amazing. It is, if you think of, you just do sort of like one little treatment kind of a thing and call that a spa day or a facial. This is on so many different higher levels than that. You are really pampered. As you said, Hillary does sort of make it just for you. So she's looking at your skin type where you might have problems, being wonderful and gentle with your skin, but thorough. And it took like an hour, and it was wonderful. I had light therapy, I had facial massages, there was cleansings, there was serums. It was amazing.
Absolutely. And so what a Hydrafacial actually is there's a handpiece, and you slide it over the skin. And I tell people, think of it as a commercial carpet cleaner. So, I always use that analogy. We can clean our own carpets. You go down to the local hardware store, you rent a carpet cleaner, and it looks better. And then you go ahead and you have a commercial carpet cleaner come in, and wow, all of a sudden that carpet almost looks new. It's fluffed up. It feels moist because they're driving moisture in it. That's what we do with the Hydrafacial as well. And they remove all the deep-seated grime because it is more of a commercial kind of technology. And so that's what a Hydrafacial is. So that's important. So cleansing our face, Hydrafacial not only takes out the debris, which will help with the texture, it actually exfoliates, so it starts to take off some of the top dead layer of skin. And so we talked about dullness as part of the concern with texture. So then you will then have a brighter skin with just that. Okay. Moving on from the Hydrafacial, then, as the patients ask us, what's the next step, right, Karina? Is I would then recommend chemical peels. Okay, and I know you had one yourself, didn't
Correct.
you? Okay, and it was quite a while ago, I think.
It was a long time ago.
Okay, so
it felt like
a long time.
Well, probably 2 years ago.
Okay, 2 years ago. Yeah. Okay, so somebody must be working you too hard.
I think so.
Okay, so you're not getting enough time to do your own self-care. I'll have to talk to your boss. All right. So, Karina, you had that done, and you're 28 now, so you were 26 when you had that done. Did you notice any peeling with that?
So actually, I did. Hillary and I went with the least aggressive because I've never had one, and she said, "You're young still. We can do something less invasive."
Right.
And I actually got a lot more peeling than we expected.
Right.
And her comment was, "Wow, you got a lot of peeling. I didn't expect that much."
Right.
So.
And so what I would explain is that's not uncommon. Is that your first peel, whether you use a lighter peel, and we'll customize it to you. So if you have real sensitive skin, we use a lesser aggressive peel. If you maybe have tougher skin, we might go with our more aggressive peels, and we're not going to get into the individual ones today, but we would definitely customize it for you, specifically the patient. But here you are for your first treatment, even though you're young, 26-year-old young Latina with thicker, oilier skin, and people who don't have that are jealous of it, you went ahead and you had a peel, and you peeled more than you thought. You peeled more than
I expected.
Hillary did,
correct.
right?
Yeah.
And so what that's doing is taking off that top layer of skin. We don't realize that when we start to get to really into our late 20s, that already now we're seeing the aging process occur. And with our skin, it usually it starts off as very young skin cells at the bottom, and then as it ages over about a 3-week, 21 plus days, the cells then start to die out, and then so we have a top layer on our skin, which are really dead cells filled with keratin, to get a little techno-nerdy for you, the listeners, and it's to protect our body, all right? But when that begins to become congested, and you're only 28, so you have probably some minimal congestion, although the scan would argue otherwise that you had. But certainly if you're an aging baby boomer like me, then you're going to notice it even more. So getting a peel, and I'm going to recommend a peel at least twice a year, and they don't have to be the type where your skin's peeling a lot, okay? But having a peel, I would say twice a year, will really benefit you because if you will, it will take off that top dead layer. Your products will work better. You'll have more of a sheen. You'll go from a dull to a brighter complexion. You will look healthier. And again, if we can make your skin look healthy, it's going to take care of the texture issue. It's going to take care of you looking younger. It's going to take care of you looking brighter and more approachable. So I would recommend chemical peels for those patients.
Yes, I agree.
All right.
And then one thing that we want to let our patients know too is that not peeling doesn't mean it's not working, right? So
absolutely. Thank you.
Yeah.
God, I knew we hired you for a reason. You're a smart young lady. Okay, I love it. So you're absolutely right, because I just had a VI peel, okay, and it was right after coming back from Maui, because I knew, as much as I'm really careful and I don't specifically go out in the sun to tan, is because of my Chinese, Greek, Mediterranean skin, I tend to pick up pigment more. So I went ahead on our last trip to our Maui Cosmetic Surgery office, and I had a VI peel, and I was initially disappointed in that I didn't see any peeling, because I'm a dude, previous general surgeon. Now I want peeling. Okay, some ladies may say, oh, I don't want too much peeling. For me, it's like, bring it on. Let's peel. But I didn't see sheets of skin coming off. However, maybe some flecks of skin. And even if you're not peeling that you can see visibly, you're getting micro peeling, okay? You're getting it at a cellular level is the way that we like to describe that. And lo and behold, several weeks after having that peel, my skin was smoother and the pigment was dramatically less. So even for me, who is on a radio show and on YouTube, and if you're interested, you can hear this show on YouTube. It'll probably be up and posted on YouTube in the next 24 hours. But even I could see that there was improvement despite my disappointment in not peeling the way that I wanted to see our skin peel. So interestingly enough, so thank you. That's a great point. You may peel more with the initial one, but because now my skin is in better shape, I'm using Retin-A, I use our skincare products, that I'm not going to peel as much as I did the first few times that I had the treatment myself. So thank you. That was a great point. Okay. What other questions do they bring up about skin texture?
So now I've done all this. What else? There's always that, what else can I do?
What else? Okay. So unevenness, if we feel roughness, and for those who know, though, if you have it, you know it. For those who don't have it, maybe it's a little hard to understand. But where the skin is unevenly thickened, I'm going to call it congested, where because maybe you haven't had the exfoliation, you're kind of feeling lumpiness, if you will, of the skin, and they can feel it on their forehead a lot of times on the cheek, and a lot of times around the mouth area. So what I would recommend for those patients is microneedling with PRF, okay? So what is microneedling? So microneedling is a process where we create little tunnels with a pen that has multiple needles. And I should mention, though, that we do something, because I'm a weenie. I wouldn't let somebody just come over my face with a bunch of little needles poking little holes in my skin. What do we do ahead of time before microneedling?
We're nice to our patients.
We are? Are we nice?
Yes,
you're nice to our patients. Okay.
We put a topical numbing.
Okay.
And let it sit for 30 minutes.
30 minutes. Okay. So that's funny. You guys don't do that for me.
Wow.
No, I'm kidding. Okay. So you have the topical anesthetic. We put it on for 30 minutes, and then as our medical assistant, you're cleaning it off. And so then our team of nurses, and that would include Mary, our lead nurse, Jessica, who's our awesome clinical laser nurse specialist, as well as Melanie, our nurse practitioner, they would then apply a gel on the skin. And it's a hyaluronic gel, which is a great hydrator, okay? And after they place that on there, then they take what is a handpiece, which might look like if you had a big ballpoint pen and you pull the top off it and you look at the hole of the top, that's what it would look like. And it has multiple tiny little needles on it. Because your skin has been anesthetized, okay, and we want to make sure it's comfortable for you, and we put this lubricant of hyaluronic acid or hyaluronic gel on the skin, then our nurse practitioner will roll that, if you will, that handpiece across the skin, and it's basically creating these little tunnels in the skin, very much like you see in an aerated lawn. Okay, do you golf?
I don't.
You don't? Okay.
I
don't. You've never been golfing.
Does mini golfing count?
Mini golfing counts. Okay.
Scandia?
Although you won't see the little aerations of the putting green. And so I go golfing maybe once every 2 years with my buddies, and you see these little holes on the green. Okay, so that's what we're creating. And so if nature is good to us, what will happen is that your body will then begin to build collagen in those little openings. Okay, we just did a consult for a young lady, a woman closer to my age, I should say, but we'll call her a young lady. And she had some roughness of the skin, and she wanted to know what to do. She is very much of a naturalist and wanted to stay away from injectables and all. And so I recommended microneedling this morning for her, and explained the procedure. So you're creating these little micro tunnels in the area, and again, if nature is good to us and your body heals well, you then begin to lay down collagen into these little tunnels, and that's part of the repair process. And so it actually improves the texture of the skin, okay, by this aeration, if you will, on the surface of the skin. And then also it's going to strengthen the skin because of the collagen creation. It's a collagen creating treatment with the microneedles. Okay, so that's something. And in addition, because we're always looking to add something on top, okay, what do we do when we bring a patient in and we're applying the topical anesthetic on there? What else are we doing for that patient for this treatment?
At the end of the treatment, we do draw their blood, but at the end of their treatment, we're using their own PRF.
Okay.
Well, the nurses.
The nurses are. Okay, so for the listeners, especially maybe for a first-time listener, so you say we're drawing blood. Okay, so what happens when you draw that blood up?
So it goes into a tube.
Okay, so in a test tube?
Yeah, in a test tube, and then we centrifuge it. So we're spinning it to get the PRF.
Okay, so it separates out so it separates out the red cells from the yellow serum, and so we pull out the area that has platelet-rich plasma, which is an area where there are a lot of platelets which help to clot our blood, but there are a lot of healing factors. I'm not going to say it's stem cell, but it's along those lines of stimulating our own biology. It's part of biostimulation, right? And that's a real key word now, hashtag word is biostimulation or biostimulatories. So we then activate that, and so it becomes from PRP, platelet-rich plasma, to platelet-rich fibrin. And what do the nurses do with that then after completing the microneedling or the micropunctures on the skin?
After it's been completed, they put in a syringe and they distribute it evenly throughout the face.
So do they inject it or do they just
It's not injected. It's what I've seen.
Okay, right. Okay.
Yeah, it's in a syringe.
There.
It's stripped over, and we help with the little Q-tip to try to spread it out all over.
So we evenly drip it over the skin, and so now this PRF serum or PRP serum is able to go down into these tunnels and stimulate even more of a healing process. And not only does it stimulate more of that healing process to improve the texture of the skin, but it also helps to calm down any inflammation so that you have less downtime with this. I personally have had microneedling, and we're going to have to do that for you since I guess we have some texture issues for you at age 28. But I actually did have that done, and with the PRP that was placed on my skin afterwards, and it feels a little bit like somebody has put egg white on your skin, okay? And in a good way, it almost felt immediately after the treatment like, boy, that feels so tight, and almost like if I smiled, my face was gonna crack a little bit because of that tightness. And I mean that in a good way, not a negative way. And so we leave that on in the evening. I don't wash it off and then wash it off the next day. And then for me, and I'm usually fairly tolerant of procedures, I actually had it done, and I remember coming in to KSRO the next day and doing a show with Robert Berardini, one of our show hosts, and talking about it, and it was really a very nice treatment. My skin felt smoother, my skin felt tighter, okay, and I do feel that it improved the quality of my skin. Going along that way, and I know we have only about a minute or so left in our show, and you were saying the patients asked us, what more can we do? What can we do a little more aggressively? So microneedling with PRP, and then we talked about hydration. Okay, we talked about hyaluronic acid being put on top of the skin as a lubricant to put the handpiece of the microneedling over the skin. We now have a product called SkinVive, SKIN, and then like Viva Las Vegas, but VIVE, SkinVive, and it's hyaluronic gel or hyaluronic acid, and it's very liquidy, and we actually put a topical anesthetic on the skin, and we actually inject it into the skin itself in multiple areas. So we're actually injecting more of this naturally occurring hyaluronic acid into the skin, which hydrates the skin. And I've actually have had it done on me, and I love it because it increases the hydration and the smoothness and the health and the quality of the skin.